Well, hello there. Welcome to the Center for Sexual Health and Wellness. I'm Dr. Jordan Soper, and today I thought I would give you a little introduction into the day in the life of a board-certified behavioral and cognitive psychologist and an AASECT-certified sex therapist specializing in anxiety, trauma, and sexual health and functioning conditions. So you have some interest? Come on in. Welcome to reception. There's definitely lots of pamphlets and different things, lots of different offices, but let me show you my favorite office, which is mine. Isn't it cool? One of the first things any patient who walks into my office notices first is Skittles. He is my favorite accessory in this office. One of the things that I really wanted this office to convey is that people are safe here, that I am an ally, that also talking about sex and sexual functioning is a very okay thing, and if not encouraged here in this office to talk about. So that is why there is a whole variety of accoutrement in the office. I'm going to give you a little bit of a tour about some of the specifics, but I want you to describe what is your favorite thing that I have here. I have so many cool ones, but I thought I'd show you some of my favorites. Come here. One of my favorites is actually my Dickosaurus Rex. It is a 3D printed Dickosaurus Rex that I got from a patient, and it is still one of my favorite things I have ever gotten. People do notice that one. It's right in the eye line of when patients get to hang out. I collect really fun intimacy pins. Most of these come from Geeky and Kinky. Some of them also do come from I Heart Guts. I adore most of them. Rad Girl Collections is fantastic. One of my other really cool things that I have here, thank you Critical Role crew for the beautiful Don't Forget to Love Each Other photo. I love that one so very, very much. Ooh, here's a really, really fun one. Thanks to my gynecologist for sending me pictures of this. When I got my tubes tied a couple of years ago, she actually took photos for me because most of us who have been in the sexual health realm, or we've at least had some gynecological education in that realm, most of us are used to seeing what a uterus, fallopian tubes, uteri, and ovaries look like, but we've never actually, majority of us have never seen what it actually looks like on the inside. So let me show you something so cool. Here's my actual uterus and my ovaries. Isn't it cool? Oh, that's my uterus. That's my fallopian tubes. Those are my ovaries. This is them getting clamped. It's so cool. But look what it actually looks like. Most of us have never actually seen what it medically looks like from the outside. Most of us are used to seeing it in its internal form to explain, or even bigger internal form. You would think this thing is massive. Look how little. Look how teeny. Look how teeny tiny she actually is. She's just so little. Look. So right there is that. Right there is that. And then, oh, right here, right this. You see that? You see that? That's an ovary. Right there. Ovary, ovary. Look how cool. Also, pretty cool. Huge shout out to my gynecologist for giving me pictures. I never got to see what my insides looked like. This is my therapy chair. I love it, and I probably need to get a new one of these days because I have definitely worked it well, but I love it so much. This is where the crying happens. At least that's the goal. One of the things that I actually have a love for is anytime I travel, anytime I'm going to conferences, or anytime I'm going to new locations, I try to stop at a local sex shop. It's one of my favorite things. It's also a really great opportunity to support local businesses. Let me show you these really adorable ones that I got when I was in Denver. Aren't these the cutest? They are candles and they will never be burned. Aren't they so adorable? I love them. Plus I love the body inclusion. I have another one. Come, it's so cute. It's so cute. So I found this when I was actually at the IOCDF conference in San Francisco a few years ago. It is a penis menorah purse. I love it so very, very much. And it's glittery. Let's be real, we love a glittery purse in this office. So that one lives right here. So these ones came from a sex shop when I was on the Big Island. So these actually came from Hilo, and it is a variety of Hawaiian-based condoms. So themed condoms, adorable. I've actually had some individuals that have brought me condoms from different countries. I love them so much. I have a novelty condom selection in this office, which I love. A big chunk of what we do in sex therapy is education. So are my drawers literally and completely full of sex toys to provide psychoeducation about them? Yes, they absolutely are. Are none of them charged? Yes, not a single one of them is charged, because I probably need to do that, but that is very low on my priority list. But at least I can show them off what they are. And truly, that's the important thing. One of my favorite things is my giant book collection here. Along with all of the plushies from I Heart Guts, along with actually some local sex shops. So thank you Deja Vu and Love Store here in Las Vegas. All of the books here are organized by theme. Here you have general sex education. Here you have more female-based sexual health books. We've got male sexual health books. We've got medically sexual health books. 2 whole sections on kink. Here is talking to children about sex and the importance of a comprehensive sex education for children. Here are couples-related issues. Here are all of the different treatment manuals that exist. Then we have a variety of just general mental health. Then we have trauma recovery ×2. Then we have how do we be supportive of our community, so the LGBTQ plus population. Then we've got general more DSMs. We've got more of like the educational, these are more for other clinicians side. Then we have more textbooks because I love textbooks. Then we have a variety of sexual health and recovery books, variety of different ones for patients. One of the things I really love about education is that you want to try to match the educational material or the resource material that we're giving our patients to their either developmental level, what their educational level is, what their interest level is. I've had some patients who really want to know the ins and the outs, but more so from a theoretical or a psychoeducation or almost like a scholarly academic focus, then they're going to get some of the textbooks. But others who just want a general introduction or books that are more written for the public. Here is the giant wall of degrees. Huge shout out to Michaels for framing all of them. Let me tell you how expensive framing is. No one told me that. That should have been part of basic education when it came to getting my degrees, is how expensive this was all going to be. That's just another rage point for me, but I do love them. They are my babies and they are never coming off these walls. Wait, I have one more really fun thing. Come here. As much as I love my current therapy chair, when it does need to be retired, have I got the perfect chair for in here? As dark and gothy as I am I definitely going to shift into utilizing my uterus chair? Yes, I am. Look how cute it is. So huge shout out to Spoonflower. This is actually where the fabric came from. Come here, come look at it. Isn't it cool? Looky. It's a uterus, that's a cervix, that's a uterus, fallopian tube, and ovaries. Isn't it so cute? I love